It is my pleasure to welcome you all to the 7th webinar of the CME topic Antimicrobial Resistance, the Rise of a Global Health Threat and Assessing Opportunities to Control It, hosted by Indian Association of Community and Family Medicine. So today we are bringing to all of you all the burning topic in community medicine and public health as a huge threat looms over us in the form of antimicrobial resistance. We have a general idea about AMR and because bacteria, virus, fungi, parasites, they change over time and no longer respond to the medicines. So making infections harder to treat and increasing the risk of the disease spread, severe illness and death. So superbugs occasionally become the trending term in today's world, but the details and measures taken against them hardly ever become the trend. So we have chosen this topic to focus on the latter, primarily for the majority of the audience who are postgraduates and are eager to have and gain an insight in the matter. But from a larger perspective, we wish to inform the magnitude of this problem to the wide community of the physicians and how this impacts the medical and the public health scenario of our country.
So good evening, everyone. So my role in this presentation will be like just to prime you about all the antibiotics which we have known till now. And we all know that antibiotic discovery was considered to be one of the greatest miracles in the world. Still, it is considered to be the same. However, with the alarming rates of increasing resistance, we need to think back whether we are taking the using this wonder drug in the proper way. So I'll be covering under the following headings, that is what are antimicrobials, antimicrobial resistance, the timeline of different developments of the various resistance, emergence and the spread of AMR, global concern, the pathogens which are mainly implicated in this antimicrobial resistance, and a summary of my talk. So there is a confusion that there are two terms. One is the antimicrobial agents, another one is the antibiotics. So these two terms are used interchangeably. But the meaning of this is antimicrobial agents. These are actually the therapeutic agents which can be used to treat a variety of organisms, including bacteria, fungi, viruses, and parasites. Out of this, whatever is used to treat the bacteria are generally called as the antibiotics. And these antimicrobial agents were present in the environment much before their clinical discovery. So this is what I told. Antimicrobials can be of various types, like biocides, which are commonly used in the environment, antiseptics, which can be used on our skin, then anti-infectives, which includes antibacterials, virals, fungals, and the antiparasitic agents. And these antibacterials are commonly called as antibiotics. So this is a way which antimicrobial resistance is increasing, and this is how development of antibiotics are happening.
Thank you so much, ma'am. Such an excellent presentation on the nooks and crannies of where AMR has developed, the history, what are the classes and what are the pathogens that we know, and we are still discovering new things, and the things that new class of antibiotics, as you said, they have not been discovered as of yet. So that is one good area of research, I think, that can be focused on. Yeah, ma'am.
Nowadays, actually, people are not using antibiotics. They have started using alternative therapies like bacteriophages, phage therapy, because there is, it is a long process and a lot of investment is required in developing an antibiotic.
Yes, ma'am.
So preserve the antibiotic. That's all we can do now, but it may not be too late.
Thank you, ma'am. So shall we proceed then? I now hand over the session to Dr. Yuvaraj Krishnamurthy. Sir, you can start sharing your presentation and we can proceed with yours, sir.
So, good evening, everyone. So, I'll be continuing with that lecture. And my lecture, I have titled as Assessing Opportunities in AMR Field, like workshops, conferences, funding. So, what I will be doing is I will be briefly touching upon the public health, clinical, and societal impact of AMR. And then I will be moving on to the various opportunities that we have for control of AMR. Because there are several national action plans are there, ICMR guidelines are there for AMR control, antimicrobial stewardship practices, those plans, so many things are there for control at larger scale, like national scale or regional level or a state level. But what we as an individual, like we as a public health professional from community medicine or from family medicine, what we can do what are the opportunities we have to contribute to the control of AMR. So that is what mainly I will be focusing on in this particular lecture. Nearly 5 million deaths are linked to bacterial antimicrobial resistance in the year 2019. And there was huge variation in terms of the region also. Like highest rate was found in the Western Sub-Saharan African region. And most of the next four was also in the Eastern and other parts of Sub-Saharan African region. But next in line after Africa is Southeast Asian countries, which also includes India. And the most common cause is the lower respiratory tract infection, which contributed to about 1.5 million deaths out of this nearly 5 million deaths that is caused by antimicrobial resistance. And the two pathogens that stopped this global mortality is E. coli and Staphylococcus aureus. So why it remains a public health challenges, as ma'am already told, it has certain clinical impacts, like it can increase the mortality, like resistant infection ultimately leads to a higher mortality rate. And it also causes a limitation in the treatment, like reduced efficacy of any first line drugs makes you to use a drug which was avoided because it has higher amount of adverse reactions. So that has to be used because of the resistance. And also it can complicate the medical procedures like surgeries, chemotherapy, and organ transplant will be even more riskier if you don't have any antibiotics that works well. In addition to that, it also has societal and economic impacts. It can put a strain not only for the individual, but also for the overall government, like national or state government, because it causes a strain on healthcare systems where the prolonged hospital stays and more number of days to stay in ICU ultimately increases the cost of health expenditure of the government. So and in addition to that, again, it also has an implication on the patients, like it can increase the healthcare cost due to extended treatments or additional treatments or requirement of higher level of antibiotics and additional days of hospitalization or ICU stay. And this is more important, especially in resource constrained settings or low and middle income countries like India. And it can also cause increased transmission because resistant infections can spread more readily in communities, which can even lead to some outbreaks. What are the opportunities that we can seek to contribute to the control of antimicrobial resistance? So these are the 4 types of opportunities which I will be exploring in this particular lecture. So whatever I say now, as I already told, are like some of those opportunities that are available, like open from reputed organizations which have some positive feedbacks. But if you want to access some more capacity building opportunities or some topics, notes, or some courses which you want to access more, means these are some of the links which I have kept where you can make note of this, and you can go to this respective links where you can find more number of opportunities, because it's not that every conference or every capacity building program happens every year. Sometimes only for that particular year it can happen, and these are some of the websites which regularly updates the forthcoming opportunities that can come with respect to, especially for antimicrobial resistance.
Before going towards the end, we will do the question answer session. Dr. Ranjit Vishwanath has asked, how do we deal with antibiotic use among animals? Can we do KP surveys among farmers? If so, are there validated questionnaires? I think this question is directed to Dr. Yuvraj, sir. Sir, can you?
Yes.
Yeah.
Yeah, sure. That was actually a very good question. Now, as I told, like there is a field called One Health, which has been coming up very much now. Like it is to find out the link between the human, animal, and environment interface to find out how the AMR works and how we can control it. So, the topic you told now is a classic example that can come under this One Health approach, where you can collaborate with veterinarians, veterinary professionals, and you can do this particular topic. Actually, what are the topic you suggested itself is a good topic, like your antibiotic use among, like doing a KP survey among the farmers to find out about the antibiotic use on animals is actually a topic which you can do, but you have to collaborate with the veterinary professionals. So that's why I told this is a classic topic which you can do on One Health, under One Health. And there are no standard validated questionnaires that are available, especially for KAP, because even in our public health topics, there are not much of validated questionnaire for KP. Like usually we develop our own questionnaire and then we try to validate it, or we try to frame a questions from previous studies which are being conducted. So for this, there is no standard questionnaire that is there, but there are so many studies that are conducted on this particular topic. Like just if you can search on this particular topic, you can get so many studies that have been conducted throughout the world. But in India, this One Health is still in the nascent stage. Now only it's gaining more recognition. So if you want to work on this One Health topic, it is a very good, and it can be a good starting point if you can work on this topic. And you can even develop and validate the particular questionnaire which you are trying to develop for this study also.
Thank you, sir. Thank you, sir, for this response. And sir, a question from my part and to ma'am also, like antimicrobial resistance is such a big, huge thing in the world, and especially I have seen many physicians in different fields doing antibiotic audit throughout mainly the tertiary hospitals and secondary hospitals. So, like after the audit, what like as physicians, what can we do, or as a public health specialist, what can we do, maybe in our practice area, to control it? Any such tips, or ma'am told about the tertiary health, that what to do. Ma'am had listed something. Adding on that, do you have anything else to suggest, sir?
Yes, actually, the study which we told we conducted, it was actually an audit, but along with that, we also assessed one more thing. There is something called antimicrobial stewardship practices that needs to be followed by all the hospitals. Like those are the practices, like strategies which we can adopt for controlling the AMR.
If you want to do some research in antimicrobial resistance stewardship, so what are the areas which are novel in those fields, so that we can do the research? Because it is one of the things which is not there in many institutes, the stewardship committee. So what do you suggest? What is your suggestion? Like, what are the novel areas in which we can do the research?
So as we told, like it's not even there in most of the facilities. So this, as a starting point, like whatever the research we conducted is to check how it is actually properly functioning now, like how it has been functioning, the antimicrobial stewardship practices. So before even going to the novel stage, we can first check like how it is being implemented, the current stage. We can do a process evaluation we can do, and to find out how the antimicrobial stewardship practices have been followed in healthcare facilities in both public and private. We can just compare and do like how it has been practiced in private and how it has been practiced in public. So that can be a starting point.
Now we are nearing the end of this session, and we really hope that, ma'am, sir, you collaborate with us very soon again, because we really love today's session, and you gave us a lot of valuable insight into this topic. Like I think 90% of the people who joined today didn't have any idea that so much is going on in AMR. So thank you for giving us that, that peek into what is behind the curtain, what is going on in the world of AMR. So thank you so much. Thank you, sir. Thank you, ma'am, both of you, for giving your valuable time today to join us.
Evening and greetings to the speakers of our session. Today's webinar was, I think, one of the best webinars I felt. Like, I think even Dr. Ria also agrees. Like, we are holding good webinars, but this is one of the best webinars till date, I felt. And I'm very grateful to you, ma'am and sir, that you have collaborated with us. And I hope in future also you will help all the postgraduate trainees and the students and all the young researchers with your wisdom. So not taking so much of time, as there is question answer round as well. So I would like to thank the audience also to take part for today's webinar. Yes, so this is our website. This is our official website. This is the Indian Association of Community and Family Medicine. And if you can scroll down, there will be 3 options right now. Like for the members, they can log in their details. After logging their details, they will get all the website content, the webinars they have attended, and the videos as well. For the non-members who has registered for the particular webinar, they will be getting only those videos. And previously we were making everything accessible in YouTube. Now we will make only some parts available in YouTube. And yes, there are people can scroll down through previous activities. I would request Dr. Ria to click on the previous activities page.
So this is a previous activities page where there is a poster for each of the webinar that has occurred till now, and on clicking the poster you can just go to the YouTube page.
Yes, if you want to access, if you want to see what are the activities we are conducting, and all are welcome to join our association and be a part of it and make it grow, so that it helps everyone in the medical field.
While ending, I'll just like to reiterate that we have successfully conducted today's webinar with the help of Dr. Rubina and Dr. Maanasa Dr. ma'am and Dr. Yuvaraj Krishnamurthy sir. And we have also officially right now launched our website iacfm.co.in, where the members will have access to today's webinar video for lifetime, and the participants who are non-members today will have the access to the video for a limited amount of time, where they can download, and after that, after some time, it will be deleted online. So all these things will be uploaded by tomorrow or day after tomorrow, and the certificates will be distributed. The members will get the certificate via the website, and the non-members will have the certificates mailed to them. So all the mails regarding that will be shared to the members and the non-members respectively. Do not worry, we will guide you through the process. And the previous webinars are not yet uploaded. We are in the process of uploading. It will be released in a phased manner, but it will surely be uploaded and all the members can access it.
One more good news is that we have collaborated with PrevenCon 2.0, and we will be sharing we will be sharing that also very soon. So please support PrevenCon 2.0, which is being conducted by TADCOM. Yes, so this is basically done by the Tamil Nadu Association of for Development of Community Medicine Practitioners. So please support this. We are in collaboration with this PrevenCon 2.0.
So with everyone's permission, I'm ending today's session, and thank you, sir. Thank you, ma'am, and thank you to all the participants.